So in full disclosure, I was never interested in the thyroid gland during pharmacy school or during any of my training. It wasn't until I was diagnosed myself in 2009 with an autoimmune thyroid condition, and that was after almost a decade of having some pretty confusing symptoms. And I really wanted to know what I could do to get myself better. I wanted to know what I could do to help prevent the progression of my condition and maybe even reverse the condition. Not many people know this, but the primary reason for hypothyroidism or an underactive thyroid is actually due to Hashimoto's thyroiditis. So this is an autoimmune attack on the thyroid gland. You may have been told that you just have a sluggish thyroid or that your thyroid is underperforming, but that's not true. Your thyroid is working overtime. It's doing its best to produce thyroid hormone while it's under the attack of the immune system.
When the immune system starts attacking your thyroid gland, it results in one of the following. Hypothyroidism, that's the underproduction of thyroid hormone, or B, hyperthyroidism, which is the overproduction of thyroid hormone.
I had something called Graves' disease, which is an autoimmune disorder of your thyroid. And with that's why I was having all these panic attacks and insomnia and weight loss and rapid heartbeat. And the tremor was all because my body was attacking my thyroid, creating it to be overactive.
The best tests to do for Hashimoto's are going to be thyroid antibody tests. The two antibodies to ask for are thyroid peroxidase antibodies. You can abbreviate that as TPO antibodies, and thyroglobulin antibodies, and that's abbreviated as TG antibodies. Now, these are lab markers indicating that your thyroid gland is under attack by your immune system. These thyroid markers can be measured in the blood for up to 10 years before you see a change in TSH, before you see a change on other thyroid markers, and many people will report that they have thyroid symptoms when they have an elevation in these antibodies. Uncovering thyroid antibodies is really, really helpful because it lets us know that we have an autoimmune process within our bodies, and this allows us to do something about it. The higher the thyroid antibodies, the more aggressive the attack on the thyroid gland, and the quicker the progression is going to happen to other types of autoimmune disease. So I really like to use the thyroid antibodies as a marker of how a person is doing.
So when someone goes to a medical doctor or endocrinologist, the approach depends on the doctor. Unfortunately, a lot of endocrinologists will recommend radioactive iodine as the first line of treatment for someone with hyperthyroidism or Graves' disease. Other doctors might recommend antithyroid medication for a prolonged period of time, such as methimazole or PTU, and hope that the person goes into remission. The problem is, of course, is that it's not doing it. Neither one are doing anything for the cause of the problem. With radioactive iodine, once not only is someone getting exposed to radiation, but oftentimes will result in the person needing to take thyroid hormone medication on a permanent basis, which some people do okay, but again, it's not addressing the cause of the problem. And with medication such as methimazole, it's fine. Some people do need to take the medication on a temporary basis. But still, it's not addressing the cause, and that's the problem with most medical doctors, most endocrinologists, is that they just resort to either radioactive iodine, or again, they might recommend the medication. And while some people might need conventional treatment, it's still, they don't do anything to address the cause of the problem.
It's really my only regret in my life is, not having my thyroid. But I didn't know me then, so and I've helped many, many people reverse all kinds of chronic conditions, reverse their autoimmune disease, reverse even Graves' disease. So it's always bittersweet when that happens. But it's, what drives me and what gets me up every day is saving somebody from the fate that I had of having to do something where you're taking toxic medication that can, cause your liver to fail, to having something extreme of having one of your vital major organs either blown up or ripped out. With insurance companies, it's cheaper, it's doesn't require surgery, the healing, so to speak, is easier. And so insurance companies, that's the first thing on their list is the radioactive iodine, and then maybe surgery. I mean, knowledge is power, and certainly I don't judge anybody if they want to go through conventional medicine. I mean, that is everyone's prerogative. I mean, I just want to give people information so they know there's another choice, so that if they want to take the other choice, they can. And if they don't want to, that's also fine. I mean, conventional medicine, I'm a conventionally trained doctor. There are some really wonderful things about conventional medicine, particularly when you are in an emergency situation.
Many people are misdiagnosed and struggle with symptoms for years, sometimes decades before they get the right diagnosis. Even when they do get diagnosed, they're often told that they just have a sluggish thyroid. They're not told that they have an autoimmune condition which is progressive. We decided it was time to abolish the myths that leave people sick and feeling totally helpless.
When you have one autoimmune condition, let's say Hashimoto's, and it isn't addressed from the root cause, that can lead to other autoimmune conditions. It can lead to imbalances with your vision and balance. I see this more and more people experiencing vertigo. It can lead to MS. It can lead to alopecia. There are a number of other autoimmune conditions: psoriasis, eczema, Crohn's, ulcerative colitis. They all start to add up, and it becomes more and more difficult to get under control.
Sadly, people are led to believe that they're losing their minds, and perhaps that they're bad people, when in reality they're just dealing with a thyroid condition.
I think the way conventional medicine is treating depression is really a disaster, and that is simply writing prescriptions for antidepressants. So I get a lot of these women, and it is women outnumbering men with thyroid issues, coming to me that have been failures, quote, failures at antidepressant therapy. They're still depressed, and they're not only still depressed, but they now have side effects from being on antidepressants. They can't sleep, or they're sleeping too much. Weight gain, huge weight gain. And, with thyroid issues, you're already gaining weight. So dizziness, nausea, lack of libido. I mean, really? So many problems with the antidepressants, and it's not directed at the cause. So when I see them, what I do is actually, using an automobile analogy, is I look under the hood. Like, what's going on there? Giving an antidepressant is simply a Band-Aid. And it's a way of getting somebody in and out of your office in 15 minutes, if that. So many of these women who had presented initially to the doctor with weight gain, depression, feeling cold, feeling withdrawn, unhappy, anxious, having sleep problems. What was really going on with them was either hypothyroidism or Hashimoto's thyroiditis.
Are you shocked to learn that many conditions that are considered psychiatric conditions are actually due to thyroid disease and can be treated, even reversed, by the very recommendations we share in this documentary series?
I always try to put myself in the position of, if I had heard, this kind of a recommendation, like a lifestyle recommendation, when I was really in my conventional mindset, like, how would I have received it? What would I have thought? And let me tell you, I would have rolled my eyes and laughed, because it's an extremely challenging mindset to, adopt when you are coming from conventional orthodoxy that says, you were born with this, there's a genetic component, it's a chemical imbalance, and it requires serious medicine, right, which is pharmaceutical.
And you'll never be able to get off of the medicine, too.
Right, and lifelong treatment, right? So to suggest that a simple dietary change, and particularly one in the case of non-celiac gluten sensitivity, that doesn't even have a verifiable test associated with it, to suggest that this is real medicine is offensive, right? It's preposterous, right? So it's only recently that I've really enjoyed a literature that's, has looked at gluten as, potential trigger. So there are crossover trials looking at, for example, like 4 grams of gluten exposure versus like a rice placebo, and that you can literally induce a depressive syndrome in the space of days.
You've got anxiety or you've got depression, and they'll be given a medication, benzodiazepine or an SSRI, and it may be their thyroid that's causing the problems. It's common knowledge that thyroid problems can cause depression. It's less well recognized that thyroid problems can actually contribute to anxiety. And I actually looked at a study that was published in 2010, and they found that there was 3 times the higher incidence of anxiety in women who have underactive thyroid. So it's more common than a lot of people realize. And certainly in my practice, working with anxious women, most of the people that I work with are women. I work with men as well, but most of the women that I work with anxiety have thyroid issues. They either have Hashimoto's thyroiditis, they have hypothyroid, or they may have had Graves in the past. So it's very, very common that I see this.
In very many cases, food intolerance, which is undigested foods and gut toxins seeping and leaking into the bloodstream, that is the root trigger.
One of the things that you really helped me with, I was figuring out my food sensitivities. And within 3 days of figuring out that I was gluten and dairy sensitive, I was able to recover from like 3 years of acid reflux and almost a decade of irritable bowel syndrome. And then I started seeing all of my gut symptoms improve, and then my thyroid markers improve as well. Can you talk about the connection between food sensitivities, autoimmune disease, and perhaps some of the tests that you like to use?
The problem with food sensitivity is that you do not feel that you are sensitive to some foods. There is no like allergic reaction, real allergic reaction. There is no histamine production. Antihistamines do not work. So symptoms develop usually maybe next day. So how could you know that the headache that you have is because of a cucumber that you have eaten, yesterday, but not with a weather change or something different, right? So that's why I think that people need to be educated. That now we have a lot of different food sensitivities, even for organic good foods. Because it's not a question of pesticides, it's a question of our reaction to the proteins that we have in different foods. The problem with autoimmune disorders, and Hashimoto's as well, is that this type of antibodies that we develop in food sensitivity against these food triggers is the same as we make against our tissues in autoimmune disorders. So if you have a trigger that you're eating every day or every other day, and it promotes antibody production, it will help, unfortunately, to promote antibody production against your thyroid. So that's why we need to know what exact triggers you have. We need to be more accurate, and we would like to help more. We need to know what other types of food could be a promoter of this antibody production. And from this point of view, of course, food sensitivity test is very, very helpful. Although the modern, mainstream medicine doesn't accept it.
Gut is everything. The gut is everything. So when allopathic doctors get a patient who has been reading about this and they say, oh, I think I have a leaky gut, they just call them crazy. And so I'm a microbiologist, and so everything in my life came full circle when I realized that, this mechanism of autoimmune disease is at its heart the gut. So stepping back, it's not just thyroid. For autoimmune disease to be expressed, you have to have 3 conditions. You can break this down. You have 1, you have a genetic predisposition. 2, you have an environmental trigger or triggers. And in your book, you talk about root cause, but we both agree that in most circumstances, a person that has Hashimoto's has hundreds of root causes. Mm-hmm. And 3, you have to have intestinal permeability. The so-called leaky gut, which I really prefer not to use that term.
As a physician.
As a physician, correct. As an MD, allopathic physician, the culture is that does not exist. However, Dr. Fasano at the NIH has so beautifully elucidated the mechanism of intestinal permeability and antibody formation and bacterial translocation with celiac disease. And so you can extrapolate that into the research that's being done with many autoimmune diseases.
In January 2015, I was diagnosed with a condition called Hashimoto's hypothyroidism. But the symptoms that I was presenting with at the time were extreme tiredness and fatigue, low energy, a general feeling of unwellness, and I noticed that my skin and my hair and my nails were all in really bad condition. Now at the time I was put onto medication, and that did help to a certain extent, but a year later I just noticed that the low energy, the tiredness was still there. So I decided to research to see was there anything else that I could do to help my thyroid problem. And during my research I discovered that there's a significant link between the digestive system and the thyroid. One of the things that was suggested was to try an elimination diet, and that would be to eliminate foods that might be causing a problem to my system. I was interested in trying this, but I just felt I needed some more professional help, and that was what brought me to Fitzwilliam Food Test Clinic. Martin was really helpful in that he explained what the test was all about and what the intolerance and the elimination involved. The test itself was relatively simple. It was just a finger prick test, and then my blood sample was sent away to the lab to be analysed to see what foods might be causing a problem for me. The things that have improved the most for me, well, definitely my skin, my hair and my nails are in much better condition. But not just that, I've so much more energy. I feel I've got motivation again to do things. If you're somebody who's suffering from the kind of symptoms I'm talking about that exist with Hashimoto's hypothyroidism, I would advise you to have a food intolerance test done. It has made a huge difference to my life, and I would highly recommend Fitzwilliam Food Test Clinic.
Thyroid autoimmune disease is very common. It mostly goes undiagnosed because testing for thyroid autoantibodies, which is the way of deciding if this is an autoimmune condition, is not the norm. As with all autoimmune diseases, we need to understand that it is some toxin that is seeping into the bloodstream and in turn triggering the immune system into self-attack mode. Food intolerance is a primary toxin and is very often the root cause of this problem.